Hello, my name's Kirsten and this is my teammate Sammy. We're training specialists for Fairview Pharmacy Services and we're here today to talk about the best practices needed to prepare immediate use medications in the home. Typically, our medications are prepared in a clean room setting which follows all USP 797 standards. However, some situations might arise where we need to prepare medications in the home due to stability restrictions, such as some enzymes that our patients are given. We put together the best practices from several outside sources, such as the Infusion Nursing Society, the American Society of Health System Pharmacists, or ASHP, as well as merging that together with standards already set in USP 797. Today we'll be talking about the personnel standards in the home, environmental standards, as well as some basic aseptic technique that should be followed in the home. For thinking about personnel standards, be sure to tie your long hair back, have no hand or wrist jewelry, no long dangling necklaces or other jewelry, and no artificial nails or chipped nail polish. You will be wearing some garb for mixing, such as a mask to cover your face and sterile gloves. Thinking about the environment that you're working in, you need to make sure that there are no fans on, close any open windows, limit people in the work area, and be sure to remove any pets from the work area. Some people may use a barrier on the hard surface and will clean that as well with a Sani wipe just prior to beginning the procedure. This area should be away from any food prep areas, any sinks or other water sources, as well as any household garbage. Let's go through the standard process of mixing a medication in the home. First, you'll wash your hands per policy at the beginning of the visit. Take out the prescription order and gather the bag of medication and any necessary supplies and place them on a visibly clean surface. The blue envelope will hold any orders for the patient, such as medication orders, pre-medication orders, as well as anaphylaxis orders for the patient. As you're gathering supplies, make sure to check that you have the right patient name, the right medication, and the bag is not past the discard after date. We have a bag of medication, a vial with diluent, as well as the final bag for the preparation to be delivered to the patient. After you set up your medication for mixing, before you begin to mix, you first have to set up the anaphylaxis kit for your patient. This needs to be on a separate clean surface within a reasonable distance to the patient location. First, you'll take out the anaphylaxis orders and set up the medications in the same sequence as laid out on the orders. If you're missing anaphylaxis orders, missing a medication, or if anything is out of date, you cannot proceed until you contact the home infusion pharmacy. Be sure to have your mask for CPR. Now you're ready to assess the patient and obtain access per policy. Once you have done so, wash your hands and don non-sterile gloves. Now we will prepare our field for mixing. Wipe your hard surface or barrier with a Sani wipe and allow to dry per manufacturer instructions. Once the barrier has dried, remove products from the packaging and place on the field. Now you will don your mask. Remove non-sterile gloves and foam. Don sterile gloves. Although this is not a sterile procedure, we still have taken the best practice from USP 797 of wearing sterile gloves when mixing medications in order to start with zero bioburden. This allows us to protect the patient. Mix drug using proper aseptic technique and compound medication per specific drug instructions. On the label, you will find specific medication instructions for mixing the drug you are working on. If any volume needs to be removed from the final bag of base solution, that volume will have been removed in the FHI clean room. We will only need to add final drug to the bag. Let's review some basics of aseptic technique. Single-dose containers, like bottles, bags, vials, and syringes, are used within 1 hour of opening or needle entry. Any contents remaining in the container are not saved for future use. Swab each vial top using a new alcohol swab. Apply friction in one direction to scrub the vial top. Swab for 15 seconds, or at least 10 long, firm strokes. Allow the vial top to dry before accessing. Ensure proper technique when attaching needle to syringe. Do not touch critical sites. Peel and present when opening needle and syringe packaging. When reshielding needles, use the scoop technique or place directly into the sharps container. When puncturing the rubber stopper on the vial, position the bevel of the needle up and apply slight pressure downward. The goal is for the tip of the needle and the heel of the bevel to enter the vial perpendicularly. This will reduce the incidence of coring. Coring is when you take a piece of the rubber stopper into the vial with you. No more than 2 entries into any one container. Use a mini spike for multiple entries into a single dose vial. If using a filter needle when drawing up medications, you must change to a regular needle before inserting into the bag. Be sure to start the infusion within 1 hour of mixing. Contact the clinical pharmacist supervisor if there's a delay for further directions. Here we'll do an example of mixing a medication with multiple vials. First, we'll swab the vial tops in one direction for 15 seconds or at least 10 long, firm strokes. Be sure to use a fresh alcohol swab for each vial top. Since we need to reconstitute 3 vials of medications, we will use a dispensing pin in the diluent vial. Reference the specific drug mixing instructions to select the correct syringe size and draw up diluent in order to reconstitute the drug vial. Reconstitute the vial following drug-specific instructions. A best practice is to run the diluent slowly down the side of the vial. Gently mix the medication vials to ensure even distribution of diluent. Inspect the vial for cloudiness and clarity, following manufacturer drug-specific instructions. Whenever possible, avoid recapping needles and place directly into the sharps container. Remove any used supplies using the garbage bag sent along with the order. Once the medication is in final solution, re-swab the tops of the vials using 10 long, firm strokes or at least 15 seconds. Remember to remove the alcohol swab from the top of the vial and allow it to dry thoroughly before accessing. Also be sure to swab the port of the bag. Drop the final dose using proper aseptic technique. When injecting the final solution into the bag, the best practice is to lift the bag up and insert the medication directly into solution. Gently mix the bag and inspect for particulate matter, cloudiness, or clarity. You are now ready to administer the bag to the patient. Administration must begin within 1 hour of mixing. If you notice any abnormalities with the bag or have to delay administration to the patient, please contact the clinical pharmacy. Discard of waste appropriately. Use a Sani-wipe to clean the barrier and allow to dry per manufacturer instructions before storage. Remove mask and gloves and be sure to wash your hands. Thank you for watching our video on mixing medications in the home. If you have any additional questions, please contact Fairview Home Infusion.